So now let's talk about it, doctor. Which drugs are safe in pregnancy? Is a very, very good question. Methyl dopa, very safe to give in pregnancy. Now coming to the various metabolites. If a drug is metabolized, the product is also metabolically active. In which situations? Zidovudine, amitriptyline, diazepam. Amitriptyline is broken down into nortriptyline. Zidovudine is basically a inactive prodrug which is converted into zidovudine triphosphate. Whereas cortisone, cyclophosphamide, azathioprine, enalapril, they are all considered to be the prodrugs which require the activation. Whereas diazepam like drugs are all active by themselves and their metabolites are also active. That's what we asked in the given question. Okay, doc. What is your confident answer? The most common cause of the bloody nipple discharge. What are you going to answer? Yes? Fibrocystic disease? What you please little louder. Ductectasia is a proposal. Even Gauri Shankar says the same. Dr. Anuja also taught it as ectasia. To think is not wrong, but that becoming right answer is the whole challenge. Because most commons are most commons anyway. Interductal papilloma is the most common cause of the bloody nipple discharge, is what need to be remembered. Then coming to pulmonary fibrosis, methotrexate, radiotherapy, amiodarone, any of them are considered to be the recognized causes of the pulmonary fibrosis, is what need to be remembered. Calcium pyrophosphate crystals are positively birefringent, as all of you know very well. Anticardiolipin is not found in rheumatoid, it is found in SLE. Then psoriatic arthropathy, can it occur without skin lesions, is an important question. It can very much occur. Even without skin lesions, people can go into arthritis mutilans caused by the psoriatic arthropathy. Now, in systemic sclerosis, what do you typically come across? SCL antibodies, not anti-nuclear antibodies. All the remaining things are true. Now, doctor, 50-year-old women, whether laughing, coughing, crying, shouting, is leaking urine. What kind of incontinence it is called and how do you treat? It's called stress incontinence. Very good. Dr. Sumati from Vizag, everybody say. But Amit proposes duloxetine for it. Do you think duloxetine is indicated for stress incontinence? What is your confident answer? Repair, is it indicated as proposed by Siri? Kegels exercises, estrogen, pessaries, they are indicated for the stress incontinence. Now, in the MI, it is the beta blockers, ACE inhibitors. If you include, they are known to improve the prognosis. Coming to broad complex tachycardia, how do you differentiate VT from SVT? One of the favorite questions of the examiner, which you have to basically answer. If it is VT, instead of normally SVT will be narrow, VT will be broad, but SVT with aberrant conduction once more can be broad. Hence it is a differential diagnosis for the VT. How to differentiate? Fusion beats, AV dissociation, atrial capture, QRS concordance, QRS more than 140, marked left axis deviation. They are all the features which are highly suggestive of VT instead of SVT with aberrant conduction, is what you have to ultimately remember. Digoxin toxicity and ECG changes. You must be rocking with authority in the tomorrow's exam, doctor. Prolonged PR interval. Why? Because digoxin is known to have vagomimetic effect. ST depression, T wave inversion, reduction of T wave amplitude and shortening of QT interval. These are considered to be the classical features of digoxin toxicity on ECG is what need to be remembered. Zollinger-Ellison is most of the times malignant. Earlier days we used to do total gastrectomy, but now the treatment is medical management with proton pump inhibitors for the Zollinger-Ellison. Coming to the GI peptides, what is the effect of VIP? VIP is known to lead to development of splanchnic vasodilatation, not constriction. Typically in hypoparathyroidism, we don't see high alkaline phosphatase, we see it in hyperparathyroidism. Always remember, hyperparathyroidism is synonymous with hypercalcemia and high alkaline phosphatase is what you are going to remember. Shoot me an answer. 30-year-old women, unpredictable urine loss, examination is normal. What kind of incontinence? How do you treat? Young, sweet looking female with unpredictable urine loss. What is the underlying cause? How do you treat? Fistula is an answer proposed by Dilip. Madhavi also says fistula, but I said physical examination is normal. Anandapur says automatic bladder. Good guesses. You are all now in high spirits of preparation to exam. Typically it is urgent continence. For example, if there is cystitis of bladder or any bladder pathology, or in some people there is an excessive tone of detrusor, they will go into urgent continence. So for them, anticholinergics like oxybutynin and beta adrenergics are considered to be the management of choice. Dementia can be treated with tacrine like drugs which are fundamentally cholinesterase inhibitors, as all of you know very well. 7-year-old boy is wetting the bed at least 3 times a week, also has ADHD. We give imipramine to treat the bedwetting and nocturnal enuresis. Desipramine like tricyclic antidepressants are known to reduce REM sleep. Hence we use them in the management of narcolepsy. Now 72-year-old, recurrent psychotic depression, same time he had multiple problems. Prostate is enlarged, orthostatic hypotension is there. For them you want to use a drug which has no anticholinergic effects, no anti-adrenergic effects. Which drug is the best one? Haloperidol is very safe. It does not have any anticholinergic effects or any postural hypotension causing property is not there for it, is what need to be basically remembered. Primary immunodeficiency, doctor. What is the most common cause? Who will give me the correct answer? Agamaglobulinemia of Bruton. Common variable in deficiency. Dr. Shweta from RMC rightly answered IgA. Dilip also correctly said IgA. Mamta also says selective IgA deficiency. Most common bole to, most common answer hi dena. Uncommon answers are not awarded. Now coming to contact dermatitis, there is no relation between allergic contact dermatitis and atopic dermatitis, which are two different entities, is what you have to basically remember. Now lymphogranuloma venereum, it's a painful, not painless, inguinal lymphadenopathy in the case of the LGV. In chancroid, unlike the syphilitic ulcer border which is indurated, chancroid is not indurated, which is the differentiator. Dermatitis herpetiform is typically it is on the extensor surface, not flexor. Where do you find on flexor surface? Allergic dermatitis is all flexor, classically. Okay, doc, I will give you 3 scenarios. Give me the answer. A boy, respiratory infection, nitroblue tetrazolium test positive. What is your diagnosis? CGD, okay. Eczema, thrombocytopenia, high IgA. HSP, I am talking about immunodeficiency disorder. Wish-Coat-Aldrich, that's good, as proposed by Manu and Dr. Dilip. 4-month-old life-threatening pseudomonas. बहुत छोटे उम्र में. लास्ट क्वेश्चन का आंसर बताओ. Which immunodeficiency? Bruton's, you said no. X-linked agammaglobulinemia, that is classical of 4-month-old pseudomonas. Eczema, thrombocytopenia is Wish-Coat-Aldrich. First one, nitroblue tetrazolium, you rightly said. Chronic granulomatous. Even our online users are also talking about immunodeficiency. One question will come, doctor. You have to thoroughly read this topic. In hemolytic transfusion reaction, there will be abnormal bleeding, which is very classical. Then post-operative period में glycogen depletion is very common. Hypomagnesemia and calcemia can be together associated features. Ringer lactate has a pH of 6.5, which is less than 7. Post-operatively, if pre-operatively patient has dyspnea on exertion, post-operative morbidity is very high when you do the pre-anesthetic checkup. Hypertrophic pyloric stenosis patients will vomit acid through gastric secretions. But they will also develop hypovolemia, due to which aldosterone is produced, which will cause H plus lost into urine. Hence they will also produce H plus in urine. Though they are vomiting acid, still urine is acidic instead of alkaline, hence it is called paradoxic aciduria, is what need to be remembered. Okay, doc. Shoot me an answer. Acute phase treatment of Kawasaki. For inflammation, what will you give? To prevent coronary artery aneurysm, what will you give? What is your confident answer? Inflammation fever के लिए क्या देते डॉक्टर? Low dose aspirin, excellent. And Dr. Abhi has rightly answered, IVIG. It is not low dose, high dose aspirin. For the inflammation, IVIG for coronary artery aneurysm prevention. Cholecystectomy for cholelithiasis, giving good amount of antibiotics to the patient pre-operatively is an example of a clean contaminated wound, as all of you know very well.